Welcome to the JEMS Report, brought to you by Clarion Events Fire and Rescue Group and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the Editor-in-Chief, along with Jeff Frankel, our Managing Editor. We bring you industry leaders and subject matter experts talking about all things pre-hospital medicine. And today we have a very special guest, Courtney O'Reilly from Illinois' Heart Rescue is joining us today. And this is a special week. Just like we came off of EMS week for National CPR and AED awareness. Thank you for joining us today.
Thanks for having me, Ted.
So if you would, why don't we start off with a little bit about your background and, who's the organization that you work with for our audience.
Yeah, so I'm Courtney. My background is in public health. I've been the executive director of Illinois Heart Rescue, or ILHR, for about 3 years now. ILHR is a state-funded program tasked with improving out-of-hospital cardiac arrest outcomes across the entire state of Illinois.
Great. So how big is this organization? We can start with there.
Sure. I like to say we're small but mighty. We have 3 full-time folks and a couple more part-time folks, and then some EMS medical directors who serve as consultants for the project. That being said, externally, we have partners across the entire cardiac arrest chain of survival. So we currently work with about 150 EMS agencies in the state, over 100 hospitals, and quite a few 911 centers who dispatch for those EMS agencies.
So other than the obvious, of course, heart care is what you're focusing on. What are the projects that Illinois Heart Rescue is focusing on?
Yeah, so we do QA/QI projects across the entire chain of survival, starting from lay responder interventions and 911 calls, all the way through hospital care and hopefully discharge back home. For example, right now we have a really exciting project with the Office of Emergency Management Communications, or OEMC. That's Chicago's 911 center. We've been working with them for about 1.5 years to improve TCPR metrics. We also work with a lot of the volunteer-based EMS agencies in Central and Southern Illinois, related to doing high-performance CPR, faster activation of lay responders for CPR and AED use. And then we also work with a lot of hospitals on their post-arrest protocols. So things like targeted temperature management, things like that.
So across the continuum from bystander all the way to healthcare provider and then discharge.
Yes.
Do you guys work on projects for after discharge care, follow up, maybe get into the realm of, mobile integrated health or community paramedic programs?
So we do run the Illinois Cardiac Arrest Network of Survivors. That's a group of survivors and their families, friends, whoever was involved in their arrest. We do quarterly educational events for them, not just to educate them on best practices, being healthier, things like that, but also just for community support. Our survivors and their families have been through something incredibly traumatic and particularly unique. They died and they were brought back to life. And so also just giving them a community space where there's someone who has experienced the exact same thing.
Right. So having so many touch points across the continuum of an event such as this, how much of a role do you guys play in research and QA/QI? You mentioned a little bit. What is your role in that, and how do you help facilitate for improvement?
Yeah, so our project pays for the license for the cardiac arrest registry for the entire state of Illinois. So we use CARES, the cardiac arrest registry, to enhance survival. And we pay for the license. So any EMS agency, PSAP, or 911 center, hospital, et cetera, can participate at no cost to them. And we like to say you can't improve what you don't measure. So giving our departments access to that valuable resource, the insight to their data, knowing where maybe the links that need improvement in their community are, has been huge. And with that, we do have a team, not only with our EMS medical directors and other physicians, but also epidemiologists. We have pre-hospital subject matter experts who work with our team. former dispatchers and call takers, EMTs, medics, all of that. We do a lot of abstracts and papers, as well as workshops for departments in the state and things like that. So it's a really fluid and ongoing process.
Great. So I'll give you an opportunity here. Why don't you tell us about some of your successes?
Yeah, so it is National CPR and AED Awareness Week. So I like to stay on the theme with that. We actually just got the 2023 annual report back from CARES, and I'm so excited to share that in the state of Illinois, our bystander CPR rates, as well as our Utstein survival, are above the national average. This is, I mean, it's a huge accomplishment on its own, but when you look at where it's been published, that Illinois has been in the past, with survival rates around 2%, that was before my time. But when you look at where we've come and how far we've gotten, the entire continuum of care has so much to be proud of. And with that, it's important to note for me personally that we've seen those improvements for all demographics. So women in Illinois are almost as likely as men in Illinois to get CPR from a bystander or lay responder, which is not the case nationally. So there's a lot of folks who have put a lot of hard work into that.
Yeah. What have you guys seen since, because of course, COVID had a huge impact on us as a whole, but and a lot of people like to say, well, I don't want to think about that anymore. But the reality of it is that coming out of that, we're very different than we were coming into it. So have you noticed anything towards the specialty of CPR, AED awareness, and community activations? Have you seen anything or noticed anything in your research?
Yeah, one of the big changes that we've been educating our 911 centers on as far as a best practice is not calling it CPR, but calling it chest compressions when they're working to get that on board with a call taker, because the general public, when they hear CPR, thinks that means rescue breaths, even though that, that's not been a thing for lay responders for a number of years now, well before the pandemic. But we've started instructing them to call it chest compressions to reduce the stigma. Like, I don't want to touch their mouth. I don't want to get close to them in that way. So that's been a big shift. And then also just folks, I think, are generally more concerned now about like being sued from a bystander perspective, not necessarily COVID related, but in the last few years, people have become more wary of getting in trouble, things like that. So we're also doing a lot of work to educate the general public on the Good Samaritan laws that are in place.
Mm-hmm. So with that and public education, how does your department help support like local agencies? Because I know working in EMS or working in education, we did things like hands-only CPR or how to use an AED, stop the bleed programs. Those are very common programs to have out into the public. But EMS agencies, of course, that's not their primary mission. So, how do you guys help along with those type of missions?
Yeah, so there are a few ways that we work with departments on their pub ed. One way is we have grants that we give to departments for training equipment. So whether it's mannequins that are for the general public or high fidelity mannequins that are actually for internal training. We have those. We also give AEDs to departments so that they can place them in whatever high need area they've identified in their community. The other thing that we do, though, is providing the CPR education. So we teach hands-only CPR, AED use, overdose recognition, and Narcan, where participants in the class actually get to take home Narcan with them. And we also do stop the bleed. So we go to communities all over the state, a lot of school districts, for teachers and students to provide that education. Because, I'm sure it's like this all over the country. A lot of our EMS agencies are horribly understaffed. And so even if they do have a pub ed department or someone who's really passionate about doing that, they just don't have the capacity to do that as often as maybe the community would like. So we go in and provide those classes. All of our services are free of charge. it's been a great way for me to see the state of Illinois in areas I never imagined I would see. But yeah, we also do a train the trainer model. So if a community champion has been identified, whether they're affiliated with the EMS agency or not, we'll put them through a train the trainer course with us just for more sustainability in the area.
So with this, it sounds, pretty similar to, programs that American Heart or the Red Cross do. Do you have overlap with those organizations, or do you, work with them to see, okay, well, we have this zone, we're pretty much in here and we're handling that, but there are areas that are missing these opportunities because we don't have the resources to go out that far. And, do you do that kind of work?
Yes, well, so we work with AHA and ARC pretty continuously with updating our training materials as new papers are published and best practices change. We're always updating our materials. As far as collaborating for education, we don't provide any certificates. Like if someone needs a BLS card, we don't do that. So that's where we refer out to our partners. That's why we're able to keep our classes free, as opposed to an AHA or Red Cross class where there's a cost associated with that certification.
Okay, great. So getting on the topic of National CPR Week and AED awareness. Yes, coming from the medical profession, no brainer, everybody understands, yes, this is important. But why a week? Where did this come from? Where did the agendas to say, hey, this is something that needs to be recognized more in the public?
Yeah, it's unfortunate when you look at the United States compared to other high income countries like in Europe or Scandinavia specifically, the uptake for bystander CPR is just incredibly low. That's a multifaceted issue. People don't know what they don't know. It's not pushed as much in schools, etc. So it is important to spread that awareness. We're also seeing there's preliminary numbers that are showing the average age for cardiac arrest is decreasing. So that's just something for folks and communities to be aware of. We are fortunate in Illinois. We have Lauren's Law. It was put in place after an unfortunate incident where a young girl did not survive her cardiac arrest. But it requires that all high school students in the state of Illinois be taught hands-only CPR at some point before graduation. Unfortunately, that is an unfunded mandate. So as expected, our low resource communities, school districts with less funding, et cetera, aren't able to implement that in the same way that our high resource areas are. So it's still important to spread awareness and connect folks to resources that do exist to provide that education.
Right. Missouri has a very similar mandate for high school students as well. And one of the places that I work, we used to do hands-only CPR, AED, stop the bleed, how to use an EpiPen, things like that for middle school and high school students. So yes, I'm very familiar with the that kind of trend that's out there for that. So when did National CPR AED Awareness Week start? Has it always been around, or is it something relatively new?
I don't actually know the answer to that question. We got that.
December 13th, 2007 is when it started. So
The more you know.
so it's kind of interesting though that it's on the list of we have National Hot Dog Day, we have National Hamburger Day, and we have these awareness things, and there's almost a sense of overload where it's every day is a potential day, but coming off of EMS week, and then we have this, these things touch close to home. It's hard to have a person or a family that hasn't had some type of interaction with this in some form or fashion, even if they're not in the healthcare profession. So, having this out and having organizations like yours, doing awareness pieces, of course, it's a 365-day thing. We should always be doing with this. We should always be aware of this, but, taking, a time out of the year to say, hey, we really need to focus on this, and we really need to look at this is important for us. especially as we grow. Some of us grow much older, we're more likely to need these resources. So it'd be nice if people were prepared for these type of things, for sure.
Absolutely.
So are there, I mean, I know you're specific towards Illinois, but of course, being a state and then of course the federal interaction with these type of programs, are they widely used or are they very common across other states? You know, if I was in rural Idaho, is there a chance that there would be a state agency that would be working on this that I might not be aware of?
Yeah, one of the great organizations that I have the privilege of working with is Project Adam. They have chapters all across the country. I think there are in most states. They're focused specifically on education for students and in schools, so training teachers, students, etc. They're amazing, and much like us, all of their resources are free to their partners as well. So I would encourage folks, if they are in Illinois, to find their local Project Adam group.
Is what's their website? Is it just, do you know?
Projectadam.org.
Just projectadam.org. Okay, great. So another resource for those of us out there. That's great. So what do you guys have planned for the week? You guys have anything special going on, or is this, yes, this is an awareness, this is a big deal, but we're busy every week throughout the
Yes.
year. So.
This is always a fun week for us. We get to do lots of media in Chicago and other areas of the state. I'm currently in Washington, D.C. I was with our friends at Every Second Counts CPR and the Sudden Cardiac Arrest Foundation. We were actually trying to break the world record for a CPR rally at the Washington Monument. So it's been a fun few days with them. But yeah, lots of exciting things coming up this summer. We have our annual training event at Wrigley Field for the Cubs game, and other community events, lots of summer camps, health fairs. So it's a fun time, busy time, but a fun time of the year.
Right. So for services or just the lay person out in the public, how would they get involved?
Yeah, if you can send folks to our website. We're at illinoisheartrescue.com, and then we are on X and Instagram as ILHR_heart. So reach out to us anywhere. I will probably be the one to get back to you. But yeah, folks who are based with community organizations, EMS agencies, and 911 centers in Illinois that don't currently partner with us, call me. I would love to chat.
Well, that's great. Well, I hope you have a wonderful time in DC. Enjoy the nation's capital and all the work that you're doing up there. Thank you for spending some time and getting the message out for National CPR and AED awareness. And of course, all the work that you do every day throughout the year is desperately needed and thanked, even if sometimes you don't necessarily get the thank you that you guys deserve. It does resonate with EMS professionals and the public as well. You know, when somebody is having their worst possible moment, a thank you doesn't always come out, but they do feel it and they do realize it. That's for sure. So,
No, thank you for having me.
Anything to close out? Any last messages? Any talking points that you want to make sure that our listeners know?
No, if folks watching have already been instructed and practiced in hands-only CPR, my only call to action for them would be to teach their family.
That's great. Yes, of course, because you know the one person who knows might not be there. So
yeah,
the more
you can help yourself in that situation.
That's right. So the more people that know, the better. And at least, you know, even if you're kind of concerned or apprehensive about doing this, the education helps. And when you have that and then, paired with the telecommunicators that when you call 911 can help walk you through, it doesn't have to be perfect. It just has to be something. It has to be, clear intent and within, good faith that you're doing what you can do. And, it all helps in the chain of survival.
Absolutely.
All right. Well, like I said, thank you very much for joining us and have a great week. And thank you again for the work that you do.
Thank you.